The NCAHP Act 2021 is a landmark development in health sector in India. It aims to regulate allied and healthcare professionals in India, who are backbone of the entire health sector. This is a central act to provide for regulation and maintenance of standards of education and services by allied and healthcare professionals. The Act also aims an assessment of institutions, maintenance of a central and state register, and creation of a system to improve access, research and development, and overall development of AHPs. There are 57 categories of allied healthcare professionals which are to be regulated under this comprehensive act. Let us know about the important role of few categories here. The medical laboratory professionals are one of the major categories. There are lakhs of medical laboratory professionals in various healthcare settings who are to be regulated under this act. They ensure an early and accurate diagnosis through detailed sample analysis and testing in various clinical laboratory departments. They are also part of teaching, training, research and development activities in healthcare. Physiotherapists play an important role in managing patients' recovery and mobility through tailored exercise programs and physiotherapy techniques. Radiology technologists utilize imaging technologies to visualize internal structures for diagnostic purposes. Radiotherapy technologists perform radiotherapy in very sophisticated work environment. They play a critical role in treatment and management of cancer. Dialysis technologists play very important role in dialysis centers. Anesthesia, operation theater technologists play an important role in surgical and anesthesia procedures. All other categories under this act are also very important members of healthcare team and play very distinct and important roles in their respective areas. There is a long history for the demand of a central regulatory body for AHPs in India. AHPs associations, including all associations under the JFMTI, were striving hard from last 2 decades. The associations under JFMTI undertaken several activities collectively at national level and taken various steps, including approaching to the courts for the establishment of a central council. The JFMTI organized its first national conference of allied health professionals in 2014 at Dr. RML Hospital, New Delhi. They strongly demanded the Secretary Health, Family Welfare, who was present during the conference, and the process was actively considered subsequently by the ministry. Again in 2016, in presence of Joint Secretary during its 22nd National Conference held at ICMLS Delhi, the JFMTI highlighted this demand. JFMTI highlighted this demand again in 2018 in presence of during its 3rd National Conference held at Pjimar, Chandigarh. Finally, the NCAHP bill was passed in the Parliament. The National Commission for Allied and Healthcare Professions Act was passed by the Lok Sabha on March 16, 2021, and it was passed in the Rajya Sabha on March 24, 2021. The National Commission for Allied and Healthcare Professions Act was enacted into law on March 28, 2021. The JFMTI requested the authorities to implement this central act in time-bound manner and highlighted this national issue again in its 4th National Conference held at Shimla to sensitize all stakeholders and highlighted this national issue in 2023. The JFMTI also organized a national stakeholders seminar of AHP's leadership on NCAHP Act at Delhi. Further, when the implementation was significantly delayed, the JFMTI again highlighted this matter during its 5th National Conference and demanded the authorities to implement this act on priority. It was strongly demanded that the implementation of the act is essential to promote the standards of practice for allied and healthcare professionals in India. Under this act, state councils in each state and UT provide regulation of education, registration, and licensing. As the Act covers around 57 allied and healthcare professions, organized in 10 professional councils, it has a larger impact on the quality of healthcare services all over the country. The NCAHP is a comprehensive law, covering large number of categories of AHPs under it, requires serious efforts of the state and central authorities for its timely implementation. As the Act was not implemented even after several years of its enactment, the Joint Forum of Medical Technologists of India, JFMTI, approached the Hon'ble Supreme Court in 2023 seeking the direction. In this national case matter, on August 12, 2024, the Honorable Supreme Court directed to all states and UTs and mandated the full implementation of the Act in time-bound manner. The Honorable Supreme Court had also set a 60-day deadline for complete enforcement, ending on October 12, 2024. However, after the direction of the Honorable Supreme Court in this matter, several states have established or notified their state allied and healthcare councils. However, full implementation has not been done by any state so far. Administrative delays contribute to the slowing down of implementation processes. Many states and UTs are yet to start this process. A serious lack of awareness among the allied healthcare professionals and other stakeholders might be a major reason of this delay. The Act's schedule classification, based on ICMLS, is also under scrutiny by many AHPs. One of the major categories, like medical laboratory professionals, are voicing concerns that the ICMLS-based classification mentioned in Act misrepresents the scope of their roles in health sector. The core issue revolves around the accuracy of role representation within the Act schedule and overlapping. Non-implementation of Act by many states and UTs is also a serious concern for all AHPs. The Act is expected to enhance education quality. The Act aims to promote global recognition. The Act seeks to standardize professional ethics and practices. Healthcare professionals must stay informed about relevant healthcare acts and regulations. Registration under respective professional councils is a crucial step for allied and healthcare professionals. Advocating for the full implementation of healthcare acts ensures comprehensive healthcare standards. The NCAHP Act is designed to empower Indian allied healthcare workforce for future generations. This standardization ensures a consistent level of quality in patient care. The Act also emphasizes ethical conduct among healthcare professionals. Adherence to these standards is crucial for maintaining public trust in the healthcare system. Training programs are standardized to ensure quality in education, training, and development. Standardized training equips professionals with necessary skills and knowledge and competencies. Enhanced competence and employability are direct outcomes of standardized training programs. Standardization ensures all professionals receive the same baseline level of training and education. Aligning with international standards facilitates global recognition of Indian allied and healthcare professionals. Global recognition creates opportunities for Indian allied healthcare professionals to work abroad. Adherence to international healthcare standards enhances the credibility and employability of Indian professionals. State councils are responsible for registering professionals. State councils are responsible for licensing professionals. State councils ensure that professionals meet required qualifications. State councils shall require ensuring that professionals meet required standards. Digital platforms shall streamline the professional registration process. Digital registration shall simplify the credential maintenance for professionals. Online platforms shall offer a centralized and efficient system for managing professional credentials. The Act aims to establish a structured framework for professional conduct. The Act also aims to enhance accountability within the healthcare sector. This framework promotes ethical behavior among healthcare professionals. Educational institutions shall be required to follow their curricula to align with the Act's standards. Curriculum updates shall ensure that graduates are well prepared for their roles. Alignment with the Act's standards ensures graduates are well prepared. The Act focuses on enhancing patient care through competent, ethical, and accountable allied and healthcare professionals. Competence ensures allied and healthcare professionals possess the necessary skills and knowledge for effective patient treatment. Ethical conduct guarantees that healthcare professionals adhere to moral principles and standards in their practice. Accountability ensures healthcare professionals are responsible for their actions and decisions related to patient care. Data analysis will be standardized to identify areas for improvement. Standardized data collection and analysis shall ensure consistent monitoring and facilitates targeted improvements. The Act establishes a legal framework for addressing grievances and resolving disputes in healthcare. This framework ensures that healthcare professionals are protected under the law. The Act also ensures that patients have recourse for healthcare-related issues. The Act promotes research and innovation in allied and healthcare professions. It encourages professionals to contribute to the advancement of knowledge and practice. This collaborative effort leads to the improvement of healthcare practices and patient outcomes. The Act aims to improve the overall quality of allied healthcare education and services in the country.